Hello everyone, my name is Garrett. I'm from Winston-Salem, North Carolina, and today I will be discussing an important topic in healthcare that I believe has the ability to create a positive change. But before I get into that, I'm going to give a little background about myself and my experiences in healthcare. During my senior year of high school, I got the opportunity to take a course to obtain my CNA, which stands for Certified Nursing Assistant. With this certification, I worked for a home healthcare agency for around a year. I would travel to patients' homes and care for them in whatever way they required. Um, these patients varied in age, they varied with different disorders, diseases, illnesses, whether that be physical mobility issues, mental disorders, or just simply various diseases. But over the course of time, I was able to see these patients, their deterioration of health over the course of time, and it kind of led me to take a step back about what I really wanted to do for a future career path. And it led me to kind of cultivate this idea that I believe has the potential to be a significant solution and a problem in healthcare. I had this idea that virtual reality technology should be implemented as a training tool for surgical students as well as surgeons so they can practice and hone their skills in a safe and in controlled environment to not endanger the patient anyway, but I think in turn will lead to potential more positive health outcomes or patient outcomes. And with this kind of correlates with my focus area. Throughout my time as a CNA, I had that clinical experience and I realized I really wanted to make a change in healthcare, but I didn't see myself doing so from a nursing standpoint because that was my original career path. But I took a step back and thought maybe health management, health leadership is the way to go if I really want to create the change I was looking for. So I'm very interested in health education and health promotion in reference to health outcomes. And with that being said, there's a specific issue I wish to discuss in this realm. Medical errors are a big issue, and according to the National Institutes of Health, nearly 250,000 people, or over 250,000 people, annually die solely in the United States due to a medical error. Medical errors are preventable errors. This is a human-made mistake, and obviously humans are going to make mistakes, but it's our job as a healthcare leader to advocate for this mistake and kind of show that we need to improve upon that, and we need to educate people in a better way that results in less preventable errors. Johns Hopkins Medicine stated that nearly 10% of all deaths in the United States every year is due to a medical error. I'm going to be discussing two lessons that I learned throughout HSMT 3201, one being value-based leadership and two being communication. In value-based leadership, according to Benedictine University, there are three specific sections as a leader that we need to focus on in value-based leadership. One, versatility. Two, self-improvement. And three, leadership accountability. Being versatile isn't as simple as it sounds. It is a diverse thing, and as a leader, we need to be able to function in multiple different ways and create solutions to problems. And we need to have our feet in many different directions if we wish to be the leader we want to be. We need to be adaptable. Personal development, as easy as it sounds, we need to be able to be coachable, teachable. We need to learn as we go. We need to improve. We need to align ourselves and understand ourselves if we wish to reflect that upon our workplace and our facility. And leadership accountability, as a leader, we need to hold ourselves accountable because, certain problems in the workplace could stem from the managing standpoint. And as managers, we need to facilitate those issues and figure out solutions so that our patients, that our employees, that our employers, and we're all working as one cohesive unit to just better a patient experience. There are also communication is my second one. Communication is also very important as a leader. You need to have effective communication because without that, a facility will not thrive in the way it's meant to. As a leader, it is our job to communicate to both patients and our employees about what our specific set of rules or ground values and beliefs are, and to create a positive environment that will lead to a better experience for the patient. There's also one ethical challenge I'm going to discuss, and that is face-to-face interaction in reference to virtual reality technology. Face-to-face interaction is a problem because we do want physicians and the patients to connect on an intimate level, and they can't do so if they're, working with this sort of technology. But I do believe it can be combated. I do not want VR to be a complete replacement for the connection between these two, the patients and the physician. Virtual reality would just be a training method for these surgeons and students so they can learn and practice complicated surgery so they can understand the various complications that could arise during a surgery. And another ethical issue would just be cost, because these technologies are not inexpensive, they are expensive. And of course, people are going to have different opinions on that, but I think it is definitely an investment that has the potential to lead to better outcomes. So as leaders, we need to advocate for those solutions. But in reference to virtual reality and healthcare education, virtual reality is not the end-all be-all solution of every problem in healthcare. It is a stepping stone. And as leaders, we need to focus on the solutions, and this is just one of many that encompasses the healthcare in all. And as healthcare leaders, and as all of you are also potentially going to be healthcare leaders, I challenge us all to not sit aside and just watch these problems occur, but to be the change. Thank you.